Hello, listeners. Hello, everybody, and welcome to another episode of Your Health Matters. My name is Carl Sterling, and I am your host. And not just your host, I'm really pleased to be your host. And especially when I have world-class experts like my guest today joining me. And we have a lot of stuff we usually talk about before we get to a guest. We are not doing that today because this guest is, I have to say, my most anticipated by our listeners and by me. I've never been more excited. So, without further ado, I would like to introduce my special guest today. Dr. Casey Means is an MD, is a Stanford trained physician, and a co founder of a company called Levels. This is a health technology company with the mission of reversing the world's metabolic health crisis. She also happens to be the author, along with her brother Callie Means, of this book, which if you're on YouTube, you will see, I can barely see it because my screen is blurred, but it's on her background, Good Energy. We were talking a little bit before. This is first of all, a New York Times #1 best-selling book, released in May of this year, called Good Energy. It's the book of all books to me. And after she reveals what she's going to reveal today, I think you'll see why you're going to want to go and get this book. I have it on audio too. She got her BA with honors and her MD from Stanford. So it's the president of her Stanford class. She has served on the Stanford faculty. She trained in head and neck surgery before leaving traditional medicine to devote her life to tracking the root cause of why Americans are so sick. She's been featured in the New York Times, the New Yorker, the Wall Street Journal, Forbes, Women's Health, and last week the Tucker Carlson interview came out. Man, that one is beautiful. Dr. Means, thanks a million for joining us.
I am so thrilled to be here, Carl. Thank you for having me.
Well, I am too, and I have to say, also joining me is another very special co-host. He happens to be related to me. Okay, I'm bragging. Yes. Sorry, Nick. He's my son, Nick Sterling, MD, PhD, based in currently in Greenville, South Carolina. Emergency room physician is specialty there, but he's also into a lot of other things, developing AI equipment for diagnosis and treatments. And Nick, I'm really glad you could join us today. This is a real treat for both of us, isn't it?
Very much
This is
so.
so special.
So, hey, you know what? I'm going to turn it over to you, Nick. You have a question you'd like to ask Dr. Means. It's all yours.
Sure things. Well, Dr. Means, thanks again for joining us. I think a good place to start would be the problem that you address in your work and in your book. So not a lot of people identify a problem in life that's worth leaving everything behind, right? So you went through a lot of training, you went through med school, you went through a number of years in residency, and you decided to leave everything behind and pursue a larger mission of human health. Can you describe for us what that problem is and what it is that caused you to leave everything and take that risk to address it?
Yes, absolutely. Yeah. So similar to you, like I'd gone down the traditional path. I did undergrad, then I did my MD at Stanford, then I did over 4 years of surgical training. And I was just about to finish my surgical training and launch out into the world of private practice or academic medicine. And things were starting to grate on me a little bit. I was so deeply embedded in my surgical subspecialty, which was so niche. It was head and neck surgery, basically ear, nose, and throat surgery, and so laser focused on this tiny little part of the body. And what I kind of started, what started creeping in was this sense that while I'm super focused on this little part of the body, there is so much else going on with American health that I, as a doctor, am totally ignoring, basically. You've got trends in American healthcare that are very bad. And when we're kind of distracted in our little specialties, we kind of miss the forest for the trees of what's actually happening in the US, which is a slow moving or fast moving train wreck. So that is really what kind of started seeping in. And once I started going down that road of thinking about, wow, like I've devoted all this time and energy to becoming a doctor, and yet I'm working 80 hours a week, and there's a much bigger problem in American healthcare that no one seems to be addressing. And so I really felt it was a moral obligation to explore that. And as I started exploring more of the chronic disease epidemic that's facing so many Americans, it ultimately led me to feel like I needed to leave my specialty and sort of focus on that much bigger issue. And so when I'm saying that there's sort of this train wreck happening, what I'm referring to is the fact that in America, we're getting sicker every year, and we're no longer getting sick from the things that killed us 100 years ago, like infectious disease. We're getting sick because of these lifestyle-based diseases that are rooted in our food choices and the way we're living in the modern world. And it's very recent, these diseases that are cropping up. So this is like heart disease, which is the leading cause of death in America for men and women, cancer, Alzheimer's, dementia, type 2 diabetes, and of course, associated obesity, late stage liver disease that is primarily now driven by fatty liver disease, which is related to our food, things like strokes, and even dying from respiratory infections like COVID or influenza. We know that actually people who are suboptimally healthy from the standpoint of chronic diseases do much worse when they get an infectious disease. So even some of the leading infectious disease killers of Americans are actually so lethal because of the underlying poor health of Americans. Then you look at other things that are happening, like mental health seems to be just plummeting, especially after COVID. 40% of 18-year-olds have a mental health diagnosis. 25% of women are on antidepressant medication. Suicide is the second leading cause of death in teens. Like, these are alarming statistics. And then more broadly, you just look at sort of public health measures. We have the highest infant and maternal mortality rates of any country in the developed world. So there's this thing happening in the United States where diseases rooted in how we're eating and how we're living are skyrocketing all at once. And because we're so hyper specialized in our American healthcare system, we kind of miss that these are totally connected diseases by poor physiology related to our diet. And fundamentally, when I unpacked that deeper and deeper and deeper, I found that there's actually a very simple connecting point between all these chronic diseases that are exploding all at once. And it's this concept called metabolic dysfunction, which is essentially this fundamental cellular problem that has to do with how our bodies actually make energy. That's what metabolism is. And across our modern world, across the processed food we're eating, we're sitting too much, we're not sleeping enough, we have chronic or low-grade stress, there's pesticides and toxins all over our food and our environment. All these things are hurting our metabolic health. And when you really trace the science to its core, you realize that that problem is actually leading to almost every chronic disease facing Americans. So once I started figuring this out, I thought, oh my God, I feel like I have a secret that I need to tell so loudly. So I, of course, wrote this book called Good Energy, The Surprising Connection Between Metabolism and Limitless Health. And I'm tracing this picture for people that even though the world seems overwhelming right now with how much disease rates are going up, there's actually a common thread between all of it that we can both understand and improve rapidly if we focus on the right issue. So this is a call to arms for everyone to understand your metabolic health, learn how to improve it, and for the healthcare system to modernize its structure so that we actually focus on root causes rather than just symptom-specific, organ-specific manifestations of this core problem in all of our different specialties. So that's my journey. That's the problem. And that's what I left to really educate, learn more about, and evangelize.
So yeah, that's just so interesting. Because I remember just before we go to a break in a minute, I'm 63. So when I was 13, 50 years ago, it's very rare to see anybody morbidly obese. A few overweight people or kids maybe in high school or whatever. You had the occasional type 2 diabetic, but it was not normal. Because it's normal now. It's sadly normal. It's not supposed to be normal. So something has changed. When we come back from the break, I have a question. I think we all know the answer, but I'd really like to hear your viewpoint on what is the change. Like, we know there's a lot in the food supply that's changed. We can talk about maybe some of the cigarette companies that bought big food and then they started to design food that's addictive. But let's save this. We have to go out for a break in just a few seconds. With me today, a very special guest, Dr. Casey Means, author of Good Energy, an amazing book, and Dr. Nick Sterling. We'll be back. You're listening to Your Health Matters. We'll be back after this short break. Okay, folks, we're back. And it's really interesting. Like I was saying before, high school, things were like this in the 70s. And so what I'm curious to know is about when in the timeline did this change in the food supply really, really hit hard? Because I remember working in a grocery store in 1977. I was 16 and stocking shelves, and there were cans and all that and a few boxes. But I don't remember all the processed stuff quite as much then as we see in the past 30 years or so. What's a timeline there?
Well, first, I would just mention that we look at the grocery stores and all the boxes and the colorful packaging and all these ultra processed foods, and we think it's normal. And because it's all we see, it's what the grocery stores. You can walk down a grocery store aisle and there's not a single piece of just whole unprocessed real food, right? It's all in boxes. And it's almost so overwhelming how much is ultra processed that we actually forget that ultra processed foods are a brand new invention. This is like last 100 years, really last 75 years, that these Franken foods made in factories have been the majority of the American diet. So we need to unnormalize this reality that we just sort of take as, oh, well, of course it's this way. Of course it's going to be impossible to get rid of all this ultra processed food that causes the disease. It's not. We literally built this in 75 years. We could easily unpack it. People used to eat real unprocessed food, right? And, in the 1850s, over 95% of Americans grew food at home, in a farm or a garden. So we've
Yeah.
lost some of these things very quickly. Now, there are a couple time points to mention of how this has gotten so bad. We're now close to 70% of our calories are ultra processed and industrial manufactured Franken foods. The first is really World War II. And so processed food was sort of an invention that was meeting a need, which was that we needed to be able to store food and transport it long distances for efforts of war. And, so fresh food was, going to go bad. And so we had to figure out how to preserve it and make it high calorie. And so that's kind of where a big boom in processed food happened. And then, of course, this was going hand in hand with things like the women's liberation movement. And you look at something that's convenient and prepackaged and pre-made and linking that with other social movements like women becoming more a part of the workforce. These trends came together to basically get a lot of Americans eating convenience food, not really thinking about the fact that it was unhealthy, right? Like
Sure.
this just seemed great. Then flash forward, you are in the 1970s and high fructose corn syrup gets invented. So US is producing tons of corn. We realize that we can actually extract a cheaper form of sugar from corn, which is high fructose corn syrup, which is now in the vast majority of packaged foods on the shelves. Yet this is actually an invention that's only 50 years old.
Mhm.
And processed food companies understood the biology of fructose and realized that this substance was actually brilliant for the bottom line of processed food companies because fructose actually makes you hungrier. Unlike many other calories, which promote
Mm.
satiety, fructose actually drives you to eat more. And that's a really fascinating evolutionary story that basically, simply put, is bears and other hibernating animals, when they eat when they get a taste of fructose rich berries at the end of summer, they're preparing for hibernation, and so they actually need to eat as many berries as humanly possible, or as possible before winter, to put on fat. So fructose, it's a molecule that actually causes us to be insatiably hungry, and now that's of course in sodas and all sorts of packaged foods. It's even in ketchup and salad dressings. So now we've got high fructose corn syrup and it's being put in everything. Then flash forward to the 1980s, and there's sort of as people are starting to realize that smoking's not so good for you. Our primary US addiction is smoking at that time. And so these cigarette companies that are employing tons of scientists to figure out how to make cigarettes addictive realize, oh man, the public's not loving cigarettes as much anymore. Let's see how we can apply some of these addictive principles to food. So Philip Morris and RJ Reynolds, which are two of the tobacco giants, acquired major food companies like Kraft and General Foods and Nabisco. And so you start to have some of the biggest mergers in American history being tobacco companies buying food companies and essentially implementing their same playbook of let's use science to make things addictive to food. So
Oh,
now you have tons of effort going into how do we get Americans to eat as much of this food as possible. Now, 30 years later, we're seeing what the results of all this is, which is that 74% of American adults have overweight or obesity. In the 1950s, there were, like you said, it was very rare to see obesity. In the 1900s, it was even more rare. There were case reports written about obesity. It was so rare.
Right. Yeah.
Yeah. So that's kind of the sequence of events. And, we basically every chronic disease that we're dealing with in the US right now are all related to ultra processed food consumption. But the two that are most obvious to people would be obesity and overweight. And then, of course, type 2 diabetes, which is blood sugar control. And like I mentioned, 74% of adults overweight or obese. And actually, this is astonishing, but 50% of American adults now have type 2 diabetes or prediabetes. 1% of Americans had type 2 diabetes in 1950, and now 50% have prediabetes or type 2 diabetes. So this is absolutely not working for us, and is causing mental and physical illness all throughout our bodies. So that's kind of the sequence of what happened with some of the the milestones of processed food.
Well, I have a quick question about that. So, for example, I remember I wrote a paper in nutrition school at the university here, Syracuse, when I started up, and I did a nutrition program, right? I won't really say anything about the program, but I'm learning a lot more in the past 20 minutes here. So anyways, I did learn a lot though. I did this paper about, well, Doritos actually, and how they were scientific, sorry, Doritos, actually like the taste of them. The problem is you can't eat just one because you have to eat all of them because they were designed, according to the research I did. New York Times had an article on it at some point in early 2011 or 12 that some people kind of went in undercover basically, and they discovered that the food engineering or the science behind it it's designed so that when it gets into your body, it short circuits leptin, and leptin doesn't tell your brain you're full, so you have to eat more because you're not. Is that anything like the fructose? Is that short circuiting a hormone? Is it that type of thing that makes you hungry when you eat the fructose?
Yeah, it's complex biology, but one of the ways that this happens is that when fructose is metabolized by our cells, it generates a byproduct called uric acid. And uric acid is a molecule that, interestingly, a lot of people may know about uric acid because it's a relationship to gout, which is when uric acid crystallizes in our joints. And just a PSA here, anyone dealing with gout listening, gout is a metabolic disease, and you can, by and large, fix it through diet. So if your doctor is telling you there's nothing you can do except take allopurinol, I highly recommend you read the book Drop
Yeah.
Acid by David Perlmutter.
Oh, that's a great one too.
It's a
Yeah.
great book. And Nature Wants Us to Be Fat by Rick Johnson, who's the
Mhm.
professor at University of Colorado, who's been the premier researcher on the relationship between uric acid and chronic disease. But uric acid, one of the things it does is it actually impairs our mitochondrial function. And the mitochondria, everyone listening might remember from high school biology, the mitochondria is the powerhouse of the cell. It's the part of the cell that actually makes energy. So you get this byproduct from metabolizing fructose that overwhelms the cell, creates mitochondrial dysfunction, and then that goes on to lead to some of the problems that drive us to be insatiably hungry, because in a sense the body thinks it's starving. It's not able to make energy if it's disrupting the mitochondria. And in animals, very interestingly, this mitochondrial dysfunction and uric acid buildup in the brain can actually lead animals to be almost like aggressive and violent because they're trying to outcompete other animals for food so they can build fat for hibernation. And so you look at what's happening in children today, we've got all of these sort of behavioral issues going up. And there's some research suggesting there's a link between all this fructose-rich processed food and some of these behavioral issues.
That's just mind-boggling, actually, mind-boggling. Okay, folks, we're going to head out for a break here. You're listening to Your Health Matters, and what a conversation this is. I'm just, again, mind-boggling. So we'll head out for a break. We'll be back in a couple of minutes. Okay, and we are back talking with Dr. Casey Means, author of a best-selling book called Good Energy, and Dr. Nick Sterling. So in that little bit there in the last segment, Does this include fruit? Can we eat fruit?
Yes, I want to be super
Thank
clear.
you.
When we're talking about the perils of fructose, we're talking about high fructose corn syrup, which is this totally concentrated, industrially manufactured, unnatural fructose rich substance. The fructose that's in fruit is the way nature intended. It's smaller quantities surrounded by fiber and lots of beautiful micronutrients and phytonutrients. So it's absorbed slower into the body. And the body knows how to process that amount of fructose without
Okay.
uric acid building up. So, not to fear, we want to be judicious with any single type of food, but I would not be concerned about the fructose in fruit.
What a relief. Thank you. Woo. Okay. Nick, I know you have a question. Go for it, please.
Sure, Dr. Means, in your book, you went into the relationship between autoimmunity, so diseases where the body essentially attacks itself, and metabolic dysfunction, so primarily diseases of energy imbalance. We're talking things like insulin resistance, prediabetes, and diabetes. Can you elaborate a little bit on how that's working biologically? Like, I remember being in a rheumatology clinic when it was way back in med school, right? And I remember these patients telling me just off the cuff that they made some dietary changes. It was a little bit different. Like every time I would talk to one, it would be a little bit of a different dietary change. But the overall story was that they were eating less processed foods or ultra processed foods, and their symptoms tended to get better. These were primarily patients with like rheumatoid arthritis, so their joint pain would decrease and that kind of thing. So I've always been very intrigued by that. Can you elaborate on that a little bit?
Absolutely. This is a fascinating area of conversation. And so first of all, to set the scene, autoimmune diseases are pretty rampant in the US right now.
Yeah.
It's estimated that about 50 million Americans now have an autoimmune disease, which is about 20% of the population. And this is going up, 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 especially in women, but also certainly in men as well. And this is conditions like inflammatory bowel disease, lupus, psoriasis, rheumatoid arthritis, multiple sclerosis. There's dozens and dozens of autoimmune diseases, but fundamentally what these diseases represent is the body's immune system fighting its own cells. So obviously we're not supposed to attack and wage war on our own cells. We're supposed to wage war on invaders like bacteria and cells infected with viruses, but that's not what's happening. And so you have to step back and ask yourself, why would the body be attacking itself? This seems so not evolutionarily beneficial. It's not. And what are the factors that could be causing the body over the past 50 to 75 years increasingly start to wage an unregulated war with our own tissues being collateral damage? And of course, that kind of leads you right back to thinking about, well, what's changed in the past 75 years? Well, we went from basically 0% of our food being from a factory to about 70% of our calories from a factory. We have 80,000 new environmental synthetic toxins just spewing out into our food, water, air, personal care products, our homes. We have chronic low-grade stress because of these devices in our hands that are streaming sensationalist, fear-inducing news 24 hours a day. There's a lot that's changed that causes our body to be confused and to be in a state of alarm. We've put in a lot of these new exogenous threats that we need to remember. If there is something that seems threatening to the body, like ultra processed food or even psychological stress or environmental toxins like pesticides, the body's going to respond. And when it responds to threats, there can be collateral damage on our body. Where it ties into metabolic health is so interesting because if you think about what are potential threats to the body that the body would wage war on, one of the things that would be most threatening to the body is if its own cells don't have enough power to do their work. So just stepping back a little bit, if you think about like, what is our life? Well, we are somewhere around 40 trillion cells in our body, and each of those cells are doing trillions of chemical reactions every second.
Mhm.
And each one of those chemical reactions requires energy to happen. And that energy is formed by metabolism, converting food to energy. Like I've said, we are becoming very metabolically dysfunctional in this country. Over 50% of us have type 2 diabetes or prediabetes. By recent estimates, the majority of our country has metabolic dysfunction because of our toxic food system and environment. So that means that there's cells in the body that can't make energy properly to do their work. And a cell that can't do its work is under distress. So those cells will actually leak out pro-inflammatory signals trying to recruit the immune system to come help them. It's essentially like a ship out in the middle of the ocean with no more fuel, and it's sending out alarms to kind of come have people come help it. But the immune system, which comes and is ready to try and support, it can't do anything to help those cells that are underpowered because the metabolic dysfunction is being caused by our environment. So you get this vicious cycle of distressed cells sending out alarm signals, recruiting the immune system. The immune system's doing the best it can, trying to essentially fight a battle, but it has no tools to help with this. And that is the storm that is happening in most American bodies today. That's chronic inflammation and mitochondrial dysfunction, and ultimately this metabolic, just tornado that's happening in the body. Now, when that cycle, the only way that cycle can be resolved is by removing the trigger that's causing the dysfunction, which is essentially all the toxic elements of our lifestyle that's hurting our metabolic health. So the ultra-processed food, the chronic low-grade stress, the environmental toxins, et cetera. And so this is a thought based on some of the research of why there's such a relationship between metabolic dysfunction and autoimmune disease. And Dr. Terry Walls, who you've had on the show, has been a huge leader in talking about this. But you look at the stats and it's actually pretty fascinating. The relationship between metabolic issues and autoimmune diseases. So for people with rheumatoid arthritis, the risk of diabetes is 50% higher. For people with lupus, they are twice as likely to have metabolic syndrome. And there's studies that have found that people with multiple sclerosis, MS, are nearly 2.5 times more likely to be insulin resistant. So this is all saying the same thing, which is that if you have metabolic disease, you're more likely to be at risk for autoimmune disease and vice versa. And the exact relationship of why that's happening is still being figured out, but what we just talked about is sort of some of the underpinning is that the metabolic dysfunction caused by our environment is creating distressed cells, which recruit the immune system. The immune system can't help. It leads to a tornado of inflammation. And part of the collateral damage is an attack on our own tissues.
That's so interesting. It was Dr. Walls was telling me that of course, she's written it in her book and it's part of her program, but it was 20 years ago or something. She was in a wheelchair.
Yes.
And I remember it very specifically, and she is part of the medical community. She's an MD, a clinical professor in Iowa, right? And she said that after 3 years of traditional medical treatment, she said, this is not working. And she just went diet. She just went into the things that she does. And then, then she starts to walk a little, jog a little, ride the bike. I mean, she's always running and riding bikes now. I see her posts and everything. So she's like, what I want to say about that is, because I want to get back to focusing on your book and your information, is she is the walking, living, breathing, talking example of there are things that can be reversed. A lot of what we're dealing with can be turned around. And of course, we're at that point we should probably head out for a break in about a minute. But when we come back, I'm curious to know is if we can think about this from when we come back to a break. We sort of started to touch on this a little bit, but there's good news about all this. The good news is we can do a lot of this changing and reversing things through dietary changes, but also other changes because they're environmental, right? I think chronic stress, I know from firsthand example, it can really just kick you right in the rear end and it can ruin a lot of things for you, cause all kinds of problems. And with that said, I think I'll leave it there. We'll come back, folks. You're listening to Your Health Matters. I'm with Dr. Casey Means. I'm with Dr. Nick Sterling. We'll be back after this short break. Okay, and we're back. So I have a question for you, Dr. Means. I've heard that for big pharma, okay, and maybe big food, I'm not really sure, but definitely big pharma, the most profit is made, generally speaking, when a young child or a youngster, very young person is diagnosed with a chronic illness, let's say type 2 diabetes. They're in this system. And then if my memory is correct, they're likely to have maybe an average of 4 other chronic illnesses that'll go along with it. At some point, they'll be diagnosed, and there's more meds, more medical services, and there's a lot of money to be made. And I am not a conspiracy theorist type of guy, but can you elaborate on this for us a little bit?
Yeah, absolutely. I mean, so this gets into some of the unfortunate ways in which the incentives and economics of healthcare are driving the state of our health in the United States, the poor health. So if you think about the business of healthcare, and healthcare is a business, in fact, healthcare is the largest and fastest growing industry in the entire United States. Some people think, oh, it must be AI or tech. It's not. It's healthcare. So this is big business. It's right now a $4.3 trillion industry, and that represents about 23% of the largest economy in the world. The largest, this is the biggest line item of our GDP, more than defense, is health. And it's getting worse. Our life expectancy is actually going down in the United States right now, despite that spending. So you step back, you think about, okay, this is a business. It's a business designed to grow. Well, how do you get that business to grow? You have more people having more things done to them, seeing more doctors over longer periods of time.
Mm-hmm.
And that's because the business model of the healthcare system, by and large, is we pay for volume. Doctors are paid for the number of patients they see, the number of chart notes that they write and bill, the number of interventions that they do. And so because of that, the underlying incentive for the business of healthcare is to just see more patients. It's not necessarily to have better outcomes. So then it gets back to your question about children. We're seeing an explosion in the rate of chronic illnesses in children: obesity, prediabetes, mental health issues, high blood pressure, fatty liver disease, behavioral issues, autism. They're all going up. Even young adult cancers are, cancers before the age of 50 are up 79% over the past couple of years. So if you think about the business model and the unfortunate extension of that incentives, what is the most profitable thing you could have for the system? It's a child with chronic illness becoming sick young, seeing a bunch of specialists and doctors, having procedures, racking up more associated conditions. It starts with obesity, then they get the prediabetes, then they get the fatty liver disease, then they get a mental health issue, then they get irritable bowel syndrome, then they get acne, then they get hormonal issues. It's like, this is what's happening. And if you think about just totally unemotionally, the economics of the healthcare system, nothing could be better for the bottom line. Nothing could be better for the return on investment for the various investors in the space. Now, none of that is to say that there's anything nefarious about what investors are doing or what hospital systems are doing. But you do have to realize there's not a financial incentive to stop that from happening because of the business model. There are other models that could have different outcomes. For instance, we could have a truly value-based care system, not really a fee-for-service system, where instead of being paid for how many patients you see, you get paid if your patient gets meaningfully better. That actually would be incredible, because what if a doctor did not get paid as much or at all if their patient was worsening rather than improving? That doctor would use every single tool at their disposal to get that patient healthy for an affordable price. And what would that lead them to? Healthy food, exercise, education and sleep, lowering their stress levels, getting rid of the ridiculous toxins that are all throughout our homes and food and water. That is what they would do, but we don't have that system. And we have in the past attempted to move towards a value-based care system. During the Affordable Care Act, there was a push towards value-based care where doctors would get paid more by Centers for Medicaid Services if they had better outcomes. You could basically get like a bonus on your reimbursements if the patient did well, and the doctors had to report on these quality metrics. Unfortunately, this got co-opted by industry. So instead of doctors having to report on a patient getting better as a good outcome, the quality metrics were things like, how many of your patients with high blood pressure are on long-term high blood pressure medication. So good outcomes was basically defined as high medication adherence in your practice rather than how many patients in your practice reverse their high blood pressure.
Wow.
So this just shows you how even seemingly good movements that on paper look good can get distorted right back into the hands of essentially benefiting industry rather than human health. But the message I have for doctors and patients is there should be one single place we're going towards in our healthcare journey, and that is healthier cells and better functioning of our bodies. It's not just, are we managed? It's, are we thriving?
That's amazing. I know Nick has a question. I'm going to save that question until after the next break shortly. I have just one off the cuff question. I just read this recently. I think it might have been Dr. Melly Meloff. Melly Meloff with levels. Something about how you're in, and correct me, I'm sure both of you know this. Your mitochondria is inherited from the mom's side. Is this true?
That's right.
100%.
Yeah.
Okay.
Yeah.
If the mom has, let's say, compromised mitochondria because they can't do the job and create the energy because of whatever, some type of dysfunction, the baby can inherit this and really be born into mitochondrial issues. Is this true?
There's a lot of layers to it. So one unfortunate thing is that a lot of babies are being born with metabolic issues now because of the state of health in our country and because so many mothers have metabolic dysfunction. This transfers to the baby in utero. For instance, blood sugar can transfer from the mother to the baby. So it's finding that babies are essentially being exposed to high blood sugar, and that can actually make the babies almost insulin resistant in utero. I mean, this is astonishing, right? Because this is totally modifiable if we just changed our diets. So there's that, which is that the fetal environment can promote us to being born with or developing metabolic dysfunction. There's also other layers to this, which is that there's epigenetics, which I'm sure you've heard about, which is essentially how our genes are folded and expressed. And epigenetic changes are heritable. So epigenetics has to do with which genes are essentially silenced or activated. And if a parent is experiencing obesity, diabetes, metabolic dysfunction, stress, depression, it changes the folding of our genome, and that can be heritable to our children. Aside from just our genetic code itself, but actually then a layer of expression of that genetic code. So, I mean, I can think of almost no greater public policy effort that we could do than improving maternal and infant diets and food access and truly like clean living in that, because that's affecting two people and can have lifelong impacts. I was born with metabolic issues. I share this in my book, which is that my mom, she had metabolic issues while I was in utero. And, it's just, it unfolded for my life so predictably. I ended up having lots of childhood illnesses like infectious diseases because metabolic issues somewhat immunosuppress you. Then I was 215 pounds by the time I was in 7th grade. And so I truly think there's no greater gift we can give our children than just really, trying to eat as much unprocessed, clean, organic food, and move our bodies and manage our stress, in that time around conception and pregnancy.
Yeah. Wow. Amazing. Still mind-boggling. My mind is reeling with all kinds of questions. Folks, we're going to head out for a break. Okay. And we'll be back after this break with Dr. Casey Means and Dr. Nick Sterling. You're listening to Your Health Matters. See you soon. All right. And we are back. So, Nick, you have a question for Dr. Means. Go for it.
Sure, Dr. Means. So, when I first started practicing emergency medicine, I was troubled because I would have patients land in front of me where they had a new diagnosis of a disease that had been brewing for, let's say, 15, 20, maybe 30 years in some cases. And it was truly a surprise to them, whether it was like new onset diabetes or heart disease is the first sign of heart disease that they had was a heart attack, or new onset cancer that could be attributable to metabolic dysfunction, that kind of thing. So I often would reflect on the idea that what if someone had just been able to tell them one thing and have a conversation with them, like you have this abnormality, a certain biomarker or a certain risk factor that they didn't know about before, and it was allowed to brew for decades and become out of control, and then they land in the emergency department. And so I guess my question for you is, given what you talked about before, a lot of these biological processes, like what you talked about with autoimmunity and metabolic dysfunction, these are essentially train wrecks that are happening within our physiology, within our cells, right? For long periods of time, but they're silent. So people they don't always really feel the effect of those, right? Like I always thought if people were able to feel what's actually happening inside their cells, we might have some different health outcomes. And it's only at the last minute that decompensation happens, right? Where you have like elevated blood sugar, which is kind of like the end state of a long process of insulin resistance. And so what you've been able to do is go out and found this company, Levels, where you're taking a continuous glucose monitor to observe continuous trends of blood sugar throughout time. And that links in with the broader concept of bioobservable data. So I guess I wanted to know, what was your thought process at that time? Like, what led you down that road? And overall, in your thinking today, like, where do you see that kind of data taking us? Where do you see 10 years, 20 years down the road we're going to be with our ability to really get a better grasp of what's going on in our bodies?
Yeah. Well, part of it came from this observation that the way we diagnose diseases in our modern medical system is so antiquated, and it's not in alignment with biological reality. So let me give a specific example. We'd have diabetes running rampant in our country. And there's basically three categories you can fall into to be diagnosed for diabetes based on a fasting glucose. You're either non-diabetic if your fasting glucose is under 100 on a single time point. If you're between 100 and 125 milligrams per deciliter of blood sugar, you have prediabetes, and then above 125, you have type 2 diabetes. Just single time point. If you fall into those buckets, that's what you have, which would make both doctors and patients think that if you're below 100, you're totally fine. And, oh, you're pre-disease, it's a pre-problem if you're between 100 and 125. And only at really above 125 do we need to start thinking about it, because then we have a problem. But the reality is that our biology is always in flux. We're on a spectrum at all times. And these diseases develop, all the chronic diseases develop over years, if not decades. And so there's no arbitrary number in which all of a sudden you have a problem and you didn't yesterday. But that is how our black and white bucket-based diagnostics makes us think as both doctors and patients, much to our detriment, because we end up ignoring things until, like you said, we decompensate into a true fulminant problem. And often then the physiology has been brewing for decades. There was a study that came out in the journal The Lancet, a premier medical journal, a couple years ago that showed that if we actually diagnosed diabetes with a different set of biomarkers, like including fasting insulin, which is an earlier marker of metabolic dysfunction, we could catch people with blood sugar issues 10 to 15 years earlier than using fasting glucose. So all of this is to say we need to find ways to see the dysfunction brewing earlier before we might actually feel it, or before we reach some diagnostic threshold that is often very, very late. So this got us really interested in starting Levels, which was focused on reversing the metabolic disease epidemic. That's the mission of our company. And what we saw was that there was this device called a continuous glucose monitor, which you stick on the back of your arm or on your belly, and it measures your blood sugar 24 hours a day, 7 days a week, and sends that information to your smartphone. And these devices right now are only FDA approved for people with type 1 or type 2 diabetes. So they're not FDA approved for prediabetes or people who are non-diabetic but want to understand their blood sugar. They're prescription only, and they are only going to be covered by insurance if you have generally pretty late stage type 2 diabetes or type 1 diabetes. They sometimes won't even reimburse them for patients who have well-managed type 2 diabetes. And we thought, geez, Louise, blood sugar problems are underlying the vast majority of chronic illnesses in our United States. There's a device that's fairly cheap and totally safe that can tell us all about our blood sugar and help us understand how our diets are impacting our blood sugar. We need to get this into hands of people earlier so we can use this technology and this information to understand our metabolic trajectory, understand how our diets are affecting our health, so that hopefully we never get to the late stage diabetes. And I can't tell you how much resistance there was from people. This was like 5 years ago. Now there's much less resistance because I think we're having some beautiful movements happening in direct to consumer healthcare, and people want to be more empowered in their health. I think there's been a big fracture, and I think COVID contributed to this, where there's a lot more distrust in just blindly trusting the healthcare system because people saw just the public policy failure of COVID, and the total absence of discussion on, how we could improve our health with our choices during that time. And so there's more of a movement towards people wanting to understand their own health and really be the CEO of their health. And so it's more mainstream now, but because it was in such conflict, the way we really think about diagnosis and intervention waiting until you have disease and then reacting to it, there was definitely some pushback initially, but it's been such a groundswell of support from individuals who want to get their hands on their data so they can make choices to live a healthier life, which unfortunately is not what the healthcare system is helping us with. So that's really the idea behind levels and glucose monitoring. And really it speaks to just a much larger trend in people demanding more access to their health data so they can make more informed choices about their own health and not give away all their power to centralized, people and organizations who unfortunately sometimes have incentives that are not aligned with our best health.
Can you elaborate a little bit on how, for someone who maybe doesn't have pre-diabetes, maybe has a touch of insulin resistance, or maybe not, what can we infer from blood glucose spikes? And are there spikes in blood glucose that are benign versus problematic? Like, for example, if you're simultaneously ingesting some kind of compound like vitamin C, like if you have it from fruit, like we talked about a little while ago, like is that somehow different than an ultra processed source? Like what sort of information can we get from watching glucose and changes in it?
Yeah. Well, our bodies naturally will have ups and downs in blood sugar throughout the day as we eat, because really anytime we eat carbohydrates or sugars, our blood sugar is likely going to rise after that food is digested. And so some baseline amount of up and downs is totally physiologically normal. And our bodies have a very exquisite way of dealing with that and taking the blood sugar out of the bloodstream, putting it into the cells to use for energy. That's through the use of insulin, a hormone that helps take out sugar from the bloodstream. Unfortunately, with our current diet, of which almost all processed foods are built on 3 different food substances: added sugars, ultra refined processed grains, and industrial seed oils. Well, 2 of the 3 of those things, ultra refined processed grains and added sugar, both flood our bloodstream with sugar. So we'll start to see much bigger spikes and valleys. And we know that those big spikes and valleys in glucose happening all throughout the day is not good for our physiology. So even if we don't have metabolic disease, having awareness of what foods and what food combinations are leading to a more physiologic sort of, basically rolling hills of glucose rather than huge spikes and huge dips can give us awareness into how to shape our diet early in our life for optimal metabolic physiology. So for just a simple example, like if I eat a banana and add a little bit of almond butter, I have a much lower spike than if I just eat a banana. So for me, pairing, sugary foods with a little bit of protein and fat, that helps.
Real sorry, going to interrupt. Got to head to a break. Folks, you're listening to Your Health Matters. We'll be right back. All right, we're back. Let's talk. I'm just curious if we can continue a little bit about what we just talked about in the last segment, and then weave it into the role of nutrition. We've touched on this a little bit. We eat better food, whole foods, organic foods. We can probably turn a lot of problems around. We can decrease our inflammation. We can maybe turn around these chronic diseases. Wondering if you could talk about some of the actionable steps that we can take towards better health in this regard.
Yes. So the beauty of the message is that there is so much we can do to turn our health around in a very short amount of time if we focus on the right issue, which is improving our metabolic health.
Mhm.
So I like to think of it in sort of 8 buckets that we can address, each of which we could talk about for hours, but maybe we could talk about a few of them. But I think about all the things that the science is telling us are hurting our metabolic health, and then how do we understand those and unpack them in our own lives to make some progress. So the buckets are addressing our food, addressing our movement and exercise patterns, our sleep, our emotional health and stress, the toxins in our environment, the way we relate to light and like sunlight and blue light in our circadian biology, the way we
Mhm.
relate to temperature, because temperature is actually a big signal for our metabolic processes. And the last one is our medications. What are we taking? Going through understanding which ones are metabolic disruptors. So those are sort of the landscape of where we can intervene in our lives to be healthier. And for me personally, I think I always start with food because food is unavoidable. We've got to get it right in order to be healthy. Our body is pretty much entirely built from food. We're constantly turning over cells in our body every single day. Billions of cells actually die and are reborn, and they're all rebuilt from food.
Sure.
So, getting food right is very, very important. And that's one of the ones where most of us are actually getting it wrong.
Yeah. I, well, I might be one of those people once in a while. I might have used to been one a whole lot. That's a whole story in and of
We've
itself.
all
But
been there.
oh man,
I'm in the same boat.
oh my gosh. Well, we were talking earlier. I don't want to take us too off track here. We're talking with somebody. I mean, I don't really like blueberries. I like blueberry or strawberry flavored things with the actual berries mixed up in. Maybe it's a smoothie, a healthy smoothie if we can make that. But if you put the potato chips in a bowl and the blueberries, I always want to go for the chips. I just really I want the salt and this and that, but seldom these days do I do it because I just can't afford this. I've had my own health issues. I'm probably better and stronger now than I've ever felt in my life. And I want to keep it this way. And I need to live to be at least 100 healthy
Woo!
because that's always since I was 5. I told mom, if you're listening, I told you when I was 5, I'm going to live to be 100, but I'm not going to do it if I eat all the potato chips and all the other stuff. So I'm a little off track here, but when we look at some of the things that I've highlighted and we've heard a lot of it before, when we look at eating more at home, maybe less out, there's a lot of stuff in the food, even some of the finer dining places. We have a guy who owns a restaurant who comes here, very fine dining. This the greatest restaurant around. And he even says once in a while in some of their stuff, I mean, it's not the optimal food, although most of it is, but still, eating at home could be a better choice. How do we
Absolutely.
eat when we're out? How would you recommend people eat when we're out, by the way?
I'll be totally honest with you. As I've learned more about how different ingredients are hurting our health, I have actually chosen to cook so much more at home. So I will tell you, I probably now make 90 to 95% of my meals at home for
Yeah.
me and my partner because it's landmines out there. And of course,
Ah,
here and there, but the things that you're facing if you're going out to eat is that the food is probably not organic unless they advertise that it's organic, which means it's sprayed with toxic pesticides.
mhm.
They are likely using cheap oils like soybean oil, canola oil, vegetable oil, cottonseed oil, peanut oil, and reusing it over and over, which can lead to the oils getting damaged and causing inflammation in our bodies. They're adding added sugar and other things to make the food taste good. So you're up against a lot. So I like to really just be very thoughtful about where I choose to go.
Sure.
You pretty much know when you look at a menu if they care about food quality because often they'll have a story on the menu about
That's
where they
true.
source their food. Oh, we get it from local farms and these are the organic partners we work with and we use only grass-fed organic meat and we only use coconut oil and tallow. Like, it's rare, but if you find a place like that where you've got a chef who's like a farmer and who really cares, patron them, stick with it. There's also some fast casual companies that are doing good work. Like, for instance, Sweet Green is a salad company that they do make pricey fast casual salads, but they're committed to regenerative agriculture, organic ingredients. They've removed cheap seed oils from their salad dressing. So they're really trying. There's other chains like Salad and Go, which actually has a lot of organic ingredients. So and there's interesting apps like Seed Oil Scout, which is an app that you can actually look and see which restaurants what use good oils or not. And it's all about just finding the places where you've talked to the people, the owners, the people, the proprietors. And no, I actually just, when I was recording the Tucker Carlson interview, I was starving because I hadn't eaten, and I saw like a burger chain, and in big letters, they said grass-fed organic beef. So I just walked in and I ordered 2 burger patties because I knew, and I said, I don't want them cooked with any oil. But it's just really paying attention and knowing what you're striving for, and then keeping a little Rolodex in your phone of the places that serve good stuff.
So in the consumer end, it really pays us to do a little bit of homework.
Yes.
And which, of course, Nick does, I do, we do, because we know that that's what it takes really to find these type of places. So let's see, we talked about cooking at home. I'm curious to know about things, just these are a little bit off things, but avoiding plastics. For example, I don't use this for people to drink. I use this for wetting up the heart rate monitor for the VO2 max testing we do here, right? Because it's just handy and it's not cold. But there's a lot of plastic out there too. When we look at food in plastic, drinks in plastic, these plastic particles, they're everywhere. And that has to have some type of effect on us that's negative, let's say.
Yeah, it's unbelievable, I think, how much plastic is impacting our health in ways that we are just starting to understand. One thing to just paint this picture for people to really understand it, there's been research that has shown that basically plastic has now been found in every human tissue. So you could do autopsies and look at the tissue under the microscope, and they can find plastic in every discernible human tissue. And there was actually a study looking at, unfortunately, fetuses that were stillborn or died at birth. And they found, I'm sorry, this was actually a study that was looking at placentas after babies had been born. And 100% of the placentas studied in the paper had plastic in the placenta. There's also been studies with babies, unfortunately, who are like stillborn or fetuses, and they found plastic in the babies' bodies. We are now, what causes strokes. One of the things that causes strokes is that there's plaques that form in the carotid arteries that go to the brain. And one of the surgeries you can do to basically remove plaques to ideally reduce the risk of a stroke is called a carotid endarterectomy, where you literally take the plaque out of the carotid artery. They are now finding plastic particles in over 58% of surgically removed plaques. So this is interesting because we're going to actually have to create new types of medicines to approach this plastic issue, because the therapies we're using for plaques and whatnot, they're not going to address the plastic. So it's all fascinating. Wow. We could talk more in the next segment, but plastic is a big deal.
Okay. Well, I'm glad I asked that question. We're going to head out to a break. You're listening to Your Health Matters. My guests are Dr. Casey Means, author of best-selling book, Good Energy, and Dr. Nick Sterling. We'll be right back. Okay, we are back. And Nick, we were talking on the break. Interesting point you brought up. Do you mind bringing that up now and asking Dr. Means your question about the plastics? That's really fascinating.
Sure. Yeah, I'd love to hear you elaborate more on microplastics or plastic-related compounds within these plaques. So typically we think about plaques in an artery wall. And I know which study you're talking about. I read that one too. I was blown away when I read it. So typically we think about soft plaques, which are at risk for rupture. There's hard plaques, which are traditionally considered more stable, right? And they have calcium in them to kind of stabilize it. So it's a way that the body stabilizes the plaque. I don't think we've really dealt with how do we deal with the varying plastic content in a plaque. Has anybody really approached that?
I not as far as I know, because I think this is all happening in real time. That study about the impact of microplastics in carotid plaques was actually just published in March of 2024 in Nature Cardiology,
Mhm.
premier journal. And so I think we're just starting to understand the impact of this. But what was fascinating is that I mentioned that 58% of people who had these carotid artery plaques removed, they had plastic in it. And for people who had plastic in their plaques, they had a 4.5-fold rise in the risk of a very bad outcome, like a heart attack, a stroke, or just all-cause mortality in the follow-up. So basically, if plastic was present, there was a 4.5-fold higher chance of having a very bad cardiovascular outcome. So we got to take this seriously, especially because this is another thing. We talked about how processed food is like a brand new invention in human history. We've normalized it, but it's really new. So is plastic. Plastic was actually invented in 1907, just over 100 years ago. And since then, we have produced 8.3 billion metric tons of plastic, and we are producing 350 million metric tons per year at an increasing rate. I mean, just think about that for 2 seconds. To just give you an example of what plastic is in, it's in all of our polyester clothing. It's in any of our non-polyester clothing that has stretch in it, because that's like a stretchy plastic material. It's in our sheets if they're synthetic. It's our water bottles, our food storage containers, the coffee cups we're using. It's everywhere. And aside from it depositing in our tissues, the other wild thing is that these plastics actually act as estrogen mimics in the body. So what are called xenoestrogens, and they contain chemicals like bisphenols and dioxins. And these are actually hormone disrupting chemicals that some of which can bind to things like our estrogen receptors in men and women. And so you're seeing things like sperm counts plummeting. Sperm counts are down 50% since the 1970s. Infertility in both men and women is skyrocketing. Fertility rates are going down 1% per year. And it kind of makes sense when you think about this ubiquitous toxic stew that we're sitting in. And I know that can sound scary, but I just want to remind people we can make changes tomorrow, both
Sure.
on our individual consumer choice level, filtering our water, swapping out plastic for glass, et cetera, and also forcing through our voting our politicians to represent these issues and to not ignore them. So there's lots we can do.
Yeah. Oh my gosh. I'm usually not lost for words. And the only reason I'm lost right now is because there's so many questions. I do have one question. Is there anything going on politically as far as congressional meetings that anyone, you, your brother, anyone are there any politicians who are having any type of wake-up call who might take any action at all in this regard?
Well, I think something very positive is actually seeing how much traction that Bobby Kennedy is getting in this. I mean, he's behind the
Yeah.
leading candidates, but he is getting in some reports 20% of
Yeah.
the vote as an independent. And so that is actually, he's talking about these things in explicit detail. Everything that we've been talking about, he's
Yes.
talking about as a key existential issue for our country. And I will say that recently, former President Trump has put up a few videos talking about how the chronic disease epidemic is something we need to focus on. I haven't seen much about how he intends to do that, but sort of in his fashion, he's talking about things like standing up to big pharma and whatnot. And so certainly I would welcome conversations with any candidate of any political party to talk about what some of the, key
Hmm.
actions would need to be taken to really fix the problem. There's also people in Congress who care a lot. Think people like, Tim Ryan and Cory Booker have been very vocal about regenerative agriculture. And my brother and I have spoken to many senators and congressmen who are passionate about this issue. I think the question for many of them is like, where is the political leverage to actually make changes? And so
Yeah.
that's something that we're having conversations about to really help everyone understand how we can align our legislature with American health in a way that hopefully is a win-win for everyone.
Well, I'll say it again, but Tucker said it first, as far as I know, is I think you're going to change the world. I think that, and, we have another segment to go, but the fact that you're even joining me at all, I can't even thank you enough because you have so much going on. You've been on the biggest, some of my favorite shows, Huberman and these other ones. I mean, we love these people, and to be with us. So certainly we're here to spread the message. I'm here to spread it with my audiences on iHeart Network to,
Thank you.
enlighten and educate. And go buy the book, everybody. You've got to get good energy. It goes into a lot of other things too. I find it interesting, just even being in nature, something John Rady at Harvard talks about a lot. I had him on the podcast years ago, and how wonderful it is we're supposed to be outside. Actually, we're supposed to be in nature, yet we're inside. I forget the percentage statistically, 85, 90, 95%, but it's a lot.
94%
94%.
is spent in the inside of four walls or in our car.
Yeah. Yeah. Well,
This
I
is
tell you,
so unprecedented.
yeah, and being outside is just so beneficial on so many levels. Fascinating, fascinating. Um, Nick, is your mind still spinning? Because mine is. Hey, we can improvise on air, so that's what we're doing right this second for a minute before we go to a break in about 2 minutes, and then come back with our last segment where maybe we can just talk about any overall takeaway messages that you have for our listeners.
I think
We had,
the biggest
we had 2 minutes
takeaway
left,
is
though.
okay. Okay. Well, I think the biggest takeaway messages that I have is that um, no matter what health condition you might be dealing with,
Mhm.
anything, any symptom or diagnosed condition that is lasting for a long period of time, so chronic, I implore you to investigate your metabolic health because it's the great masquerader. If the body is underpowered, which is metabolic dysfunction, it can look like almost any symptom. So that it might not be the key driving cause of why you have an autoimmune disease or, why you have depression or whatnot or anxiety. But if we get metabolic health under control, which is the foundation of all health, it's the gas to our car, right? It is the literal
Sure.
plugging in our body to the socket, then everything will be easier. And the way that you can do that very simply is by asking your doctor for some simple lab tests that they will be happy to order generally that are very cheap that can give you a picture of whether you're on the right track. And I'll just mention, I go through all of them in my book, but the key ones you want to get at least every 4 or 5, 6 months are a fasting glucose, a triglyceride level, HDL cholesterol, a hemoglobin A1C, a blood pressure, an LDL or an ApoB cholesterol, and to do your own waist circumference. And I mentioned those tests because they're cheap and they are basically define metabolic syndrome. If you are not optimal on some of those markers, it says there's a problem in how your body's making energy. And you can fix those things very quickly. But we each need to understand these biomarkers for ourselves regularly.
Absolutely. All right. With that, we're going to head out for our last break and come back with one more segment with my very special guest, Dr. Casey Means, and my co-host today, Dr. Nick Sterling. This is Your Health Matters. Thanks for listening. We'll be back in a couple of minutes. Okay, we are back for the last segment. It's been such an honor to have you with me, Dr. Means. And Nick, I'm so glad you could join us today. We were both
Absolutely.
really looking forward to this a lot. So
For
Oh,
sure. For
the
sure.
this
more
is
that
a
we can tell
joy.
you, Well, in the interest of, let's say, moving forward with actionable steps, things we can do, because I have to say there's one more thing. I leave this out, and I want to say to listeners, there's a time and place for medicine, surgeries, medication. But I will argue that even though I'm not a doctor, a lot of the things that are happening shouldn't be the norm. And I could go off on that for a long time with some of the surgery that happened that shouldn't really be happening because we can usually do something without the surgery. Medications that chronic diseases that cause us to need medications. Well, bottom line is there is a time and place for everything. But what we're trying to do is address this battle, this to declare war on chronic disease, chronic illness, and give now some, let's say, hope into, okay, what can we do? We'll move forward. I know, Dr. Means, you have some ideas maybe on meal components of meals. Could you shed a little light on that for us, please?
Absolutely. Yeah. I think, the path to health starts with our fork. And so we got to get our meals right and we can
That's a
really
great
eat our
quote.
way to good health. And I think the number one thing, I'll just start with what to take out and then we could spend some time talking about what to put in. But the number one thing we want to take out is ultra processed foods. So these are the foods that have long lists of ingredients. We should all become avid, passionate label readers. And if the food has ultra processed grains, so this is like bleached white flour, if it has added sugars like cane sugar, high fructose corn syrup, there's about 60 names for sugar, so you should learn them. Or these industrial seed oils like vegetable oil, canola oil, safflower oil, sunflower oil, corn oil, peanut oil. We just should not buy the product. If it
Mhm.
has anything like a food coloring like red 40 or yellow number 5 or whatever, if it's got a blue, yellow, or red, do not buy it. If it's
Mhm.
got a long word you can't understand, just don't buy it. It's ultra processed food. It's not going to be good for your body. So that's what to take out. If you do that, if you eliminate ultra processed food, your life will transform. I really do
Mhm.
believe that.
Mhm.
And you won't be as hungry because ultra processed food is designed to make us insatiable.
Right.
Then it's what to put in. And so I think about food very first principles, like ignore the dietary dogmas because it's marketing. It's people just yelling at each other on social media. You have to be carnivore, you have to be vegan, you have to be paleo, whatever. Fundamentally, we want to think about food from first principles, which is what does our body actually need to function properly?
Mhm.
And when you trace that, there's really 5 components that I try and include in every meal to make sure I'm really doing my best to meet the needs of my cells. So this is having every meal include a fiber source, an antioxidant and micronutrient source, an omega-3 source, a healthy protein source, and a probiotic source. And
Oh,
so what this comes down to is to like make a short list in your head of a few foods that meet each of those categories. And then cooking kind of becomes mixing and matching different components from each list. So for
yeah.
instance, for me, for omega-3s, I love wild caught salmon. I like sardines. I like chia seeds. I like hemp seeds. I like walnuts. Those all have a good omega-3 amount.
Hmm.
For healthy, for antioxidants and micronutrients, I'm just thinking like colorful fruits and vegetables as fresh as possible because the fresher they are, the more nutrients they're going to have. So I'm thinking about like the bell peppers and the purple cabbage and watermelon radish and just really colorful things that are filled with antioxidants.
Hmm.
For fiber, I love to always have beans, legumes, um, chia seeds, raspberries, avocados. Those are actually all high fiber foods. So all that is to say, if you have, and I have the list of basically the foods that have the top amount of that particular category in my book. So you have a long list, but just mentally note those
Yeah.
things. And then when you're building a salad or you're building a sandwich or you're building a dinner, make sure to include a little bit of each. And it's
Yeah.
the nice thing is if you are vegan or you are keto, you can actually still include all those elements in your meals. And that means you're giving your cells the building blocks and the information they need to function properly.
I was gonna say, although my screen is blurred here, and for the YouTube viewers, in the book, in the back of the book, there's an extensive number of recipes in there. You know, there's breakfast, there's other meals, there's all kinds of things. So this is a very, very comprehensive a list or set of recipes you have in there, which is beautiful. Appreciate that a lot. Which
Thank
means
you.
I need to plug your book, and people, you need to go buy the book. Good Energy: The Surprising Connection Between Metabolism and Limitless Health by Dr. Casey Means and Callie Means, your brother, correct?
Yes. Yes, my
Yeah, and
brother.
well, I love him too on Tucker's show. It's just beautiful to hear what he had to say. So get that book. So let's continue talking about more of these things we can do. So we talked about the food element. Do you have any other recommendations, let's say lifestyle type of things? That we talked a little bit about getting outside, maybe reducing some screen time. What other thoughts do you have on this?
Yeah, I mean, we've got to get moving. It's unprecedented how much we're sitting.
Yeah.
The key thing to realize, I mean, everyone knows that, right? But I think the real key that was an unlock for me is understanding that our biology, our cellular biology works differently when our bodies are moving than when we're sitting. And so I think of like you want to have these like little snacks throughout the day of movement. And it can't just be 1 hour at the end of the day, because then for the other 23 hours, the biology is that sedentary biology. You can't
Mhm.
counteract those 23 hours of sedentary biology with 1 hour of exercise. So how do we actually keep those pathways, those metabolic pathways active to stoke that fire all throughout the day by being at a standing desk, getting a treadmill desk,
Yeah,
or simply setting a timer for every 30 minutes and doing 10 air squats or a push up or two, or
sure.
taking a walk around the block every hour. So every time we do that, like low grade movement, but more consistently throughout the day, we keep our glucose blood sugar channels at the cell membrane. We activate metabolic pathways, and it keeps us humming all day long. So, of course, exercise is great, like an hour of more intense exercise, but it doesn't compensate for all day movement. So, that's a big one. And like you said earlier, Carl, I think getting outside is really another huge one. I mean, we could talk about the actionable habits all day, but I think one of the key ones is we need to be outside more during the day. The average American child is spending less time outdoors than a prisoner in the United States.
Oh
We
my
are locking
gosh.
ourselves inside the four walls of our home. We're staring at screens over 7 hours a day. And this is so tough on our ability to be healthy because one, it removes us from the big picture perspective about the world. You go
Hmm.
outside, I'm looking out my window right now, like the sun is shining, there are flowers, there are
Hmm.
birds, there are clouds in the sky. It's incredible. And all of that actually engenders a sense of like safety and joy that makes the health journey so much easier. So go outside, take a walk, try and
Yeah,
spend more than a few hours outside a day. And I think that honestly will be one of the most motivating things you can do to want to be healthy, because you'll re-engender your sense of passion for the beauty of the world and your own body and its place in that world.
I love it. I love it. Uh, I can't thank you enough for joining us, Dr. Means. Thank you so much.
My
I've
pleasure.
learned so much from you through, reading your books, watching your interviews online, and today here. Yeah, Nick, thank you for jumping in today and asking some great
Yes.
questions that I never would have thought of.
Thank you,
Thank
Dr.
you.
Nick.
Thank you.
Yeah, it's been a real pleasure, a real pleasure.
Thank you.
So to listeners out there, I also want to thank you for listening to this show. We really appreciate this a lot. I appreciate it a lot. And my message always at the end is one of the things that I think is very important is to show some love. Be kind, be respectful to others. Take the higher road sometimes when you don't want to. Instead of getting into an altercation, just show some love. Be kind. We'll be back next week with another episode. Remember, go out and buy Good Energy by Dr. Casey Means. Thank you, Dr. Means. Thank you, Nick. Have a great day. Thanks, everyone, for listening.
Awesome. Thank you so